Hello, everyone. Welcome to our Professional Boundaries webinar. My name is Sameera Merchant. I'm a physiotherapist and a practice advisor with the College of Physiotherapists of Ontario.
Thank you for joining us today. My name is Mary-Catherine Fraser-Saxana, and I'm a physiotherapist and a practice advisor with the college. Members of the practice advice team speak with physiotherapy students across Ontario each year to discuss the concepts of professional boundaries and to provide real-life examples of how boundaries are applied and upheld in physiotherapy practice. We also discuss cases and scenarios where boundaries were not properly maintained and how that harmed patients. This webinar today is for those physiotherapists who have not had the chance to be a part of one of those workshops. We're going to present 5 different scenarios that include examples of boundary violations, and then summarize how to incorporate good practice principles into your daily physiotherapy practice. In our webinar today, we will use the term physiotherapist, or PT, to refer to physiotherapists. Let's get started. What are boundaries exactly? As physiotherapists, we must always maintain professional boundaries with our patients. Professional boundaries are the physical and emotional limits of the therapeutic relationship. It is our responsibility as the healthcare professional to uphold and maintain professional boundaries. Strong professional boundaries enhance patient safety and improve patient outcomes.
Thank you, Mary-Catherine, for setting the context. Now, let's look at applying these principles to real practice scenarios. Scenario 1. A physiotherapist works in a small private clinic. His front desk staff have gone home for the day, and his colleague has taken Friday off. He welcomes his last patient of the day, who is a patient he is seeing for the second time. He is seeing the patient to address shoulder blade pain. The physiotherapist instructs the patient to remove their top and lay face down on the table. He leaves the room and knocks before re-entering. The physiotherapist explains to the patient that he will begin by mobilizing their shoulder blade and unclips the patient's bra. He then leans against the side of the table as he works on the patient's upper back area. The patient, being face down with their arms by their side, feels something hard move into their hand, feels an immediate sense of danger, and tenses up. The PT senses discomfort in the patient and asks them to instead turn on their side. To make the patient feel more comfortable, the PT uses a pillow between their body and the patient, but notes that the patient is no longer able to relax, and the PT cannot effectively perform any manual therapy. The PT opts to instead teach a few exercises, and the patient leaves without confirming a follow-up appointment. The patient calls a friend upon leaving the clinic about what happened, beginning with being alone with a therapist and no other staff, having the therapist unclasp their bra without permission, and that they felt the physiotherapist had an erect penis during their treatment session. The patient reported that being alone on a Friday afternoon in a clinic felt unsafe, and the combination of having their bra undone and then something hard inside the therapist's pants made them feel extremely unsafe. The friend encouraged the patient to submit a complaint to the college. In responding to the complaint, the PT had sensed the patient's discomfort, but rather than address it directly, opted to instead use a pillow for a subsequent treatment technique. He denied having an erect penis during their interaction, but admitted to practicing with his cell phone in his front pocket. Mary-Catherine, could you share with us what steps the PT should have taken or considered?
Thanks, Sameera. There are some lessons to be learned from this scenario. Let's highlight some of the elements of good practice that were missing. In this scenario, good practice would include never practicing with anything in your pockets. As we can see from this story, things can be misunderstood for something else. So never practice with anything in your pockets. Never undo a patient's bra unless it's absolutely clinically necessary and the patient is physically unable to do so on their own, and the patient consents to you doing so. Good practice includes appropriate draping and use of a gown if needed. Consider how you would expose the least amount of your patient's body as needed. And good practice would also include the use of barriers, which is a good starting point, but don't forget to bring patients along in your clinical reasoning and explain touching and physical contact every step of the way throughout any of the physical techniques. Good practice would also include ongoing consent and communication, because those are key to creating safe spaces for all patients, but especially for those who may have a lived experience of trauma. Good practice includes recognizing when a power imbalance exists above and beyond that inherent in a healthcare appointment. Examples of this might include the solo practitioner alone in a clinic with a patient. There are also power differences to consider related to age, gender, and body size, as well as language and cultural differences. Let's talk a little bit more about power imbalances. Every healthcare interaction functions on a balance of power, with the healthcare professional holding that balance of power thanks to their knowledge and title. Various factors can further affect the balance of power. Some of these are intrinsic to you, such as your height, weight, gender, or age. And some factors are extrinsic to you, but that could be included your experience, your education, your reputation in the community, and resources at your disposal. Consider how these factors may contribute to you having a position of privilege in the society where you are practicing.
Thanks, Mary-Catherine, for sharing those important insights. Let's look at another scenario together. Scenario 2. A physiotherapist with a focus in pelvic health works in a private clinic facility. The physiotherapist was providing care to a patient for the third time, and this would be the patient's second time having internal pelvic floor treatment. The physiotherapist was sure to check in with the patient to ensure that they consented to the internal treatment, and the patient assured them that they did. While performing the internal treatment with their fingers inside the patient's body, the PT asked the patient about their weekend and what social activities they had done. The patient admitted to going on a date. The physiotherapist made what they thought to be a lighthearted joke about the person they dated and what sexual activity might have happened. The patient did not laugh and left the appointment feeling betrayed and humiliated. They never returned to complete their pelvic floor rehabilitation. The patient contacted the college to report the incident. They felt the physiotherapist was not professional and did not recognize the vulnerable position that the patient was in when the inappropriate joke was made. What can we learn from this scenario, Mary-Catherine?
Thanks, Sameera. In this scenario, good practice would have included keeping the conversation steered towards professional topics related to the clinical care and the physiotherapy appointment. It would include avoiding jokes and comments regarding someone's dating or sexual activities or someone's appearance. Good practice recognizes the vulnerability of a patient before making a lighthearted comment. What position is that patient in? Are they partially undressed? Are they unable to see what the treatment is that's being provided? Spend some time discussing what and why you are recommending or providing a specific treatment. Bring the patient along in your clinical reasoning and your train of thought. And finally, good practice in this scenario would have included the consideration of trauma-informed care and incorporating principles of sensitive practice. Remember to have a look at some of the resources linked at the end of our webinar today, which include the Handbook of Sensitive Practice or a short video which summarizes the principles of sensitive practice.
Thank you, Mary-Catherine, for sharing those valuable insights and those resources that will be very useful to all physiotherapists across all practice settings. Now let's move on to another clinical scenario, Scenario 3. Smita is a university student who made an appointment at a local physiotherapy clinic for treatment of her ankle pain. The PT who performed the assessment was an experienced physiotherapist and had recently moved to Ontario from outside of North America. The PT, following the initial assessment, prescribed manual therapy treatment and a home exercise program over 2 visits. Because Smita's symptoms were improving significantly, she happily booked 2 more visits for the following week. Over the weekend, Smita received a friend request from the PT on Instagram. She wasn't sure how to respond, but seeing as she did not want to jeopardize her treatment, and next appointment confirmed the friend request. When she next logged into Instagram, Smita noted that the PT had commented on some of their older posts, specifically while being on vacation and any food-related posts. At the next appointment, the PT greeted Smita with a hug in the waiting room and then brought her back to the clinic room using their hand on her shoulder to guide her down the hall. In the clinic room, Smita felt that the PT was holding onto her foot while discussing the social media posts, rather than being focused on the progression of her range of motion, performing manual therapy, or assessing her strength. Smita chose not to return, despite her ankle not feeling fully rehabilitated, because she felt that the PT was getting too friendly and was uncomfortable with the hugging. She reported feeling unsafe during their final interaction and unfriended the PT on her social media. Mary-Catherine, could you talk us through what Smita's PT should have considered?
Thanks, Sameera. In this scenario, good practice would include having the physiotherapist set up 2 separate social media accounts. One that is clearly for professional activities related to clinic and physiotherapy care, and the other that is for personal uses for friends and families. Personal accounts would be kept separate and distinct from patients' social media accounts. Good practice would also include creating a policy regarding how clinic and staff should engage with patients with regards to social media. The consideration of professional communication in all aspects of interactions with patients is an important aspect of professionalism and good practice. Good practice also includes keeping the conversation in the clinic focused on clinical care and the goals of treatment and not on the patient's social media posts. Good practice would also include eliminating casual touching, friendly touching, or any touching at all that should be that is not clinically indicated. So consideration of differences between cultures and consider minimizing casual hugging and touching in the clinical setting. Good practice would recognize that the physiotherapist has professionalism, and that's more important when working with patients of similar age and social circles often, so that the care remains very professional. And finally, good practice would include a review of the social media guidance principles, which are on the CPO website and linked to the bottom of our webinar today.
Thank you, Mary-Catherine. Let's continue building on our learnings of professional boundaries by reviewing a fourth scenario. Scenario 4. A physiotherapist works in a busy rehabilitation hospital. The therapist had recently gone through some major life changes, including the breakup of their marriage and the death of a parent. The therapist noticed that it was getting harder to arrive at work on time, despite always having enjoyed their career. A new patient had recently been added to their caseload, and following the assessment, the PT found themselves looking forward to working with this patient. They shared many common interests, such as restaurants and fashion, and the PT found the conversations to be stimulating and comforting. The PT found they could easily be open with the patient about their difficulties and shared with them what was going on in their personal life, including feeling depressed, missing having a partner for intimacy, and feeling grief-stricken at unexpected times. The physiotherapist arrived one day at the hospital to discover that the patient had been moved to another PT's caseload. Their manager asked to meet with them, and it was relayed to the PT that another healthcare provider had overheard the personal aspect of their last conversation with the patient and felt that professional boundaries had been crossed. The manager explained to the PT that they had kept the focus of the therapeutic session on themselves and not on the patient by including intimate details of why their marriage had ended. The manager suggested to the PT that they take some time to focus on their mental health and encourage them to get some professional supports in order to better maintain their professional boundaries. Let's hear from Mary-Catherine about what steps should be taken or considered with respect to professional boundaries in this scenario. Mary-Catherine?
Thanks, Sameera. In this scenario, good practice would include a physiotherapist prioritizing their mental health and well-being and proactively seeking supports with mental health professionals, not leaning on patients for support. Good practice includes a physiotherapist not sharing personal details about their personal life that were traumatic to them. And good practice includes a physiotherapist who seeks peer supports for finding that work-personal life balance. A physiotherapist would also be practicing in good practice if they requested a leave of absence so that they had the ability to cope when things became overwhelming. Including in-services and department training around professional boundaries and how they are connected to patient safety and outcomes of care would also be good practice in this scenario. Thoughtful practitioners can often avoid the risk of boundary violations by being aware of their own personal risk factors. Risk factors include conditions that lead to an imbalance between your personal and professional life, such as financial problems, stress in your personal relationships, and births or deaths in the family.
Thank you, Mary-Catherine. Let's look at one final scenario, scenario 5. A PT has been working in a private clinic since graduating 4 months earlier. They had been working with a patient of a similar age who had been living with chronic back pain for 6 sessions. The PT had noticed that they really looked forward to working with this patient. They noted that the patient was often very complimentary of their treatment style, their approach to patients, and even to their appearance. The PT, slightly embarrassed, had often reciprocated with kind words, encouraging the patient to keep up with their exercise program and complimenting their progress. One day, the patient arrived wearing high-heeled shoes. They were excited to show the PT how much better their back pain was and that wearing 3-inch heels no longer caused their pain to worsen. The PT congratulated the patient and even complimented them on the muscles in their legs since doing their home exercise program, saying that they looked hot. The patient then presented the PT with a gift card to a restaurant as a thank you for helping them with their progress to this point and suggested that they celebrate their success by going to dinner together. The PT agreed to meeting the patient for dinner, reasoning that they really do get along well and that they have done a great job on improving their pain and function. The PT and patient began a consensual sexual relationship. The PT had offered to transfer their care to a colleague, but the patient refused as they felt that they did not want to risk the improvement in their back pain. After 3 months of dating, the PT decided to end their personal relationship because they had met someone new. The patient, upset, discussed this breakup with their social worker. The social worker, upon hearing that the patient was dating and having a sexual relationship with their physiotherapist, recognized the disclosure as a mandatory report of sexual abuse of a patient and reported the PT to the college. Mary-Catherine, could you talk to us about what good practice should have looked like in this setting?
Sure, thanks, Sameera. Well, in this scenario, good practice would have included not making comments of a sexual nature to patients, as this alone constitutes sexual abuse. We should avoid making comments to our patients regarding their appearance. Good practice would include establishing strong professional boundaries that would include not socializing with patients and not accepting gifts within the clinical setting that could potentially influence how the therapist feels or how the patient relates to their therapist. Good practice includes transferring patients to a colleague at the first sign of a professional boundary violation. Good practice also includes respecting the rule of not dating or engaging in sexual relationships of any kind with patients until at least 1 year has passed since the date of the last clinical encounter, and that the patient is no longer dependent on the therapist for any healthcare-related issues. A reminder is that there is no such thing as a consensual sexual relationship with a patient. It is always considered as sexual abuse.
Thank you for joining us to learn about professional boundaries. And please feel free to reach out to a practice advisor if you have any questions related to the scenarios reviewed today, or if you need more information regarding any of the topics covered in today's scenarios. We are a free, anonymous service.
Thank you for watching.